This is a small brief on the various activities that are happening at IIT Hyderabad related to fighting with COVID-19 that we are all throughout the country, and not only in the country, everywhere else in the world are struggling to cope up with it and find solutions to overcome the difficulties that we all have. In this, first and foremost, I would like to mention that quite a number of faculty at IIT Hyderabad have been helping the local administration in terms of variety of activities. For example, starting with making some sanitizer and giving to local administration on a daily basis. We have been providing about 100 liters of sanitizer to the local administration, and this amount can be anytime increased provided somebody is in need. So we have the capability of doing that. Quite a number of people are working on this. In addition, things like the mask, face shields, these are also being prepared and distributed to local administration. That is another on a voluntary basis. And a lot of research also is being happening in these areas. For example, in the case of face shield, our people have come up with reusable and autoclavable face shields, where only the filter alone you change and rest of it can be reused. And similarly, we have a Center for Healthcare, and in that one of the incubatees have come up with again a sustainable sterilizable face shield and a protective gown, which they call it as U-Safe, which is again tested and validated, and it is ready for production. People are also have come up with UV boxes to disinfect the masks, and a number of such products are coming up in the area of PPEs and face shields and masks. In addition, people have started working very seriously on ventilators. We have one of our, again, a startup that has come out of Center for Healthcare, has come up with a very low cost and portable ventilator, which is called G1 Lite, which some of you are already aware. This is Aerobiasis, which is a startup. In addition, some faculty from mechanical engineering have started working on a low cost portable and easily manufacturable mechanically actuated ventilator, which now HMT has taken up and started in the process of making it in large scale. They have also come up with a small mobile robo which can go to the patients in wards who are COVID patients, which are and distribute whatever medicines or food that need to be distributed to such patients. People have also come up with one-stop ECG, which is a portable, low-cost one, which can be carried in ambulances or used in hospitals or even at home. And this is something which is a very low-cost one and can be mass-produced very easily. People are also coming up with drugs and vaccines. Okay. And a number of faculty both in biotech department and biomed department and also chemical engineering department, materials department are all working together on, for example, a wearable patch which can prevent quick spread of COVID virus. This is one that they have come up with. They have also come up with smart accessories such as filters which can kill this virus, and testing of these is happening in CCMB, and as soon as the tests are done, we will be in a position to start tying up with some industry to make this on a large scale. People are also coming up with various sensors not only to detect but also to monitor. For example, sensors to detect the virus in individuals, very ultra fast rapid biomolecular based sensors. People have also come up with wristbands which can detect the symptoms of COVID in people. And people have also come up with rapid, affordable, portable screening kits for such a virus. People have also come up with sensors that can track and monitor COVID patients with Bluetooth based wearables. That is another area where quite a number of faculty have come up with products which are almost prototypes ready, and thorough testing is going on in most of these cases. People have also developed a number of apps, for example, and various softwares for handling the situation. For example, some of our faculty have come up with some apps which the local administration has used for distributing medicines to people, and also groceries and things like that, so that you can monitor. Even to monitor quarantining, that's also another app that people have come up with, where they are able to track the people who have the virus in them, and to check whether they are being properly quarantined or not. In fact, people have also come up with IoT enabled remote monitoring devices which can monitor temperature and respiratory data in such patients. People also have come up with visual surveillance in a online mode, where social distancing, whether it is being carried on well, or whether the people are wearing the mask or not. This also is happening in a big way. And in addition, we have also adopted about 5 villages nearby under this Unnat Bharat Abhiyan, where our faculty have been supporting them in various ways, including, for example, making them aware of various aspects related to the virus, and about social distancing, the importance of social distancing, and how to handle such situations. Our faculty have been, through online mode, they have been helping all these villages in knowledge sharing basis. In addition, and also providing them whatever necessary provisions and food that is needed for people in such villages where there is a need. So that's another aspect where quite a number of faculty and students, many of the students, are also involved in this work. I'm really thankful to the whole faculty fraternity. I can see, though it's a lockdown period, quite a number of faculty who are staying on the campus are working day and night on all these aspects, and coming up with useful tools which can help the people and the society at large under these difficult situations. And I'm really grateful to all the students and all the faculty for really sparing a lot of their time and coming up with very useful products. I think that is something which I thought I would share with all of you. Thank you very much.